So another video from Bios Academy. It's a concept of negative appendectomy. That is, you have done laparoscopy, assuming that there is appendicitis. Once you put the port and go inside, and what you find is a normally appearing appendix. But typically, the patient might have given you the complaint of pain in the right iliac fossa, and your clinical examination also might have told you that you are dealing with acute appendicitis. But once you go inside, you find out that it is a normal looking appendix. So, what to do now? So what to do is you have to inspect the distal 60 centimeters of the ileum, because there might be certain other pathology in the ileum which might be mimicking appendicitis, like Crohn's disease, which may present with having some obstruction of the distal ileum, or there may be some kind of stricture there. So these kind of things can happen. Or sometimes what happens is there might be a mesenteric lymphadenitis, which might mimic appendicitis. So other structures which are close to it is the tube and the ovary. So sometimes there may be a large ovarian cyst, or there might be a torsion of the ovary, which might again mimic appendicitis. In some certain situations where there is a large redundant sigmoid colon, so this might come onto the right side, and this may mimic appendicitis. So all said and done, in these situations, it is prudent to remove the appendix, because at least we can come to know the differential diagnosis. We can make it out of the differential diagnosis. So again, in certain situations like Crohn's disease is there. In Crohn's disease, what happens is, if you are removing the, it is very careful. Well, you should be very careful while doing appendix surgery in Crohn's disease, because if the if the inflammation is more localized towards the base of the appendix and at the cecum junction, what happens is, once you clamp and resect the appendix, there is a chance of developing a post-operative fistula, which is very difficult to deal with. So, if it is the tip of the appendix inflammation, yes, you go ahead for appendectomy. But if it is at the base and the cecal junction, it is better to avoid to do a appendectomy. Happy.